Hi, new friend. Welcome to That Nurse Teacher, where curiosity meets clarity. I break down healthcare topics so you can level up fast. Whether you're a student, a professional, or a patient, I've got your back. Together, we're making education less of a chore and more of a conversation. So, tell me, have you ever listened to doctors talk? It can sound like they're speaking some kind of wizard ancient dialect with words like electroencephalogram and cholecystectomy. You'd think they were casting spells rather than diagnosing sinus infections, which, by the way, is sinusitis. You might feel like you need a decoder ring just to keep up. The good news is today you're going to get one. Medical terminology is not a secret language that's designed to make you feel dumb. It's actually a logical system built from ancient puzzle pieces. Most of these words come from Greek and Latin because apparently the Greeks and Romans were the original anatomy nerds. They did a lot of the early work in anatomy and medicine, so naturally they got to name everything. Their system is efficient. Like suspiciously efficient. It packs a ridiculous amount of information into just one word. So, for example, appendectomy means the surgical removal of the appendix. That is shorter, faster, and way more precise than saying, we are going to yank that angry little organ out. So don't think of it as like memorizing a dictionary. Think of it as becoming a word detective. You're looking for clues. There's little pieces that make up a whole. Each piece has a meaning. Learn a few, and suddenly you can decode several words you've never seen before. It's like having a superpower, but instead of flying, you get to understand your own medical bills. Now let's break it down piece by piece. Medical words are built like Legos. You've got your core brick, which is the combining form. Then you have a front piece prefix and a back piece suffix. When you snap them together, you get a full medical word. Let's start with the star of the show. That's the combining form. This gives the word its medical meaning. It's the subject of your painting, if you're an artist. So say you're painting a heart, the heart is your subject. The combining form for heart is cardio. That's CARDI/O hyphen. Notice that I said some extra things in there. So the O after the slash is your combining vowel. It's like a little drop of glue. Sometimes you need it, sometimes you don't. So how do we determine that? If the suffix starts with a consonant, you're going to keep your O. But if it starts with a vowel, you can ditch that O. For example, cardio is a combining form that means heart, and logi is a suffix that means study of. Now we're trying to create a word using these parts that means study of the heart. In order to do that, we're going to combine cardio with logi. Now, if I were to drop my O, it would be cardiology, and that doesn't make sense. That doesn't sound right. If I keep my O, then I get cardiology. We're going to keep our O. In this instance, my suffix started with a consonant, L, and that's why we kept our O. In a new example, if I'm going to use the suffix AC, which means pertaining to. Now I am combining cardio with a suffix that starts with a vowel. If I kept my O, it would become cardioac, which doesn't work. So I'll drop my O and the word will become cardiac. Cardiac means pertaining to the heart. One more time, I want to stress that when we have a suffix that begins with a vowel, we drop the O. And when we have a suffix beginning with a consonant, we keep our O. This is the rule. You're almost always going to follow the rule. Now let's talk about suffixes. Suffixes are dramatic endings. They clarify the medical meaning of the word. And it's like a plot twist at the end of a movie. You think your word means one thing, and then, nope, it means something else. Then you add a different suffix, and it means something else. Then you add a different suffix. And I think you see where I'm going with this. You can make so many words out of one combining form just by changing the ending. For example, the combining form neuro means nerve. We can combine neuro with many different endings to mean different things. Neuritis means inflammation of the nerve. Neuralgia means pain of the nerve. Neurology means study of the nerve. See how that works? There are so many suffixes that mean different things. But I will say that there are at least a dozen that mean pertaining to. So if you ever have a test and you don't know the answer, take a wild guess that it's pertaining to, and you might be right. As a teacher, you didn't hear that from me. The main thing to know is that suffixes can be for an adjective, a procedure, a process, a disease, a medical specialist, or specialty. They're descriptor words. They're going to describe what you mean by that combining form. Whenever you make a medical word, you're pretty much always going to have a combining form and a suffix. Now, not always, but sometimes you're going to have a prefix. Prefixes are optional, but they're also useful because they further describe the medical meaning of the combining form. Prefixes go on the front of the word. They can be for location, direction, amount, number or speed, degree or quality. They have a hyphen on the end of the word part. So for example, intra means within. We already know that cardiac means pertaining to the heart from our previous discussion. So now our definition for intracardiac would be pertaining to within the heart. Now, if you notice, I didn't say pertaining to the heart within. There's an order to how we read the definition of these medical words. Whenever you have a combining form and a suffix, you're always going to read the definition of the suffix first and then the definition of the combining form. That is why cardiac means pertaining to the heart instead of heart pertaining to. If you have all three, a suffix, a combining form, and a prefix, you're going to say the suffix definition first. Then you jump over to the prefix definition and end with the combining form definition. We always end with the definition of our subject, and we always describe our subject first. Let's talk about a couple examples of prefixes. We've got hypo, that means low, and hyper, that means high. Brady means slow, and tachy means fast. Poly means many, while mono means one. Let's take an example from one of these. If we look at the word hypoglycemia, we can break it down into parts. I know that my combining form is glyc-cha-o. Glyc-cha-o means sugar. Now that I know that glyc-o means sugar, I can determine what my other word parts are. In this example, it looks like we dropped the O on glyc-I-o. Why? Because our suffix starts with a vowel. Our suffix starts at the E. The suffix is emia, which means condition of the blood. Okay, so now I know that I'm having a condition of the blood, of sugar, but I still have a prefix to define. Our prefix is hypo, which means low or deficient. Putting this all together and stating my definitions in the order we discussed means that hypoglycemia means condition of the blood, deficient of sugar, aka low blood sugar. Notice that I said hypo means deficient, but originally I said low. This is because sometimes these word parts mean multiple similar things. If you look it up, hypo will likely say low below or deficient. I can use whichever one of those I want in my definition that makes sense to me. Now that we figured this out, I want to build and break down some more words with you. At this point, you are turning into a linguistic surgeon, and I am so proud. Our next word, gastroenterology. Okay, that word is already built. Let's break it down. We know that logy is study of. Since it starts with a consonant, we know we are keeping our combining vowel, and the O can stay. An interesting thing you will notice about this word is that it has two combining forms. Gaster-o means stomach, and enter-o means intestines. The way we will read this is study of the stomach and intestines. This is a weird example because it doesn't totally follow our rules, or at least we don't think so at first. See how we kept that combining O on gaster-o even though the next word part started with a vowel? Well, that's because the next part of the word is not a suffix, okay? It's okay to keep the combining vowel between two combining forms if needed. Not only can you have more than one combining form, you can also at times have more than one suffix. This is less common, but it does happen. We don't usually have more than one prefix, but there's always a break to every rule. So again, if I'm going to say this word in order, I'm going to say study of the stomach and intestines. Next, I am going to give word parts. And I want us to build the word by putting them together. We again have a word with two combining forms. The first word part is the combining form osteo, and the second word part is the combining form arthro. Lastly, we have the suffix ets. Osteo means bone and arthro means joint. At the end, we have ets, which we know means inflammation. If we combine the parts, we get osteoarthritis, which means inflammation of the bone and joint. Okay, now for a game of what the heck does that mean? Speed round. Dermatitis. Dermatitis means inflammation of the skin. Now, let's do bradycardia. Bradycardia means condition of a slow heart. Nephrology. That means study of the kidneys. Intravenous. Intravenous means pertaining to within the vein. Myalgia. Myalgia means pain of the muscle. So what have we learned? Medical terminology isn't scary. It's just a puzzle with a little vowel drama. Once you know the pieces, you can build and break down words like a linguistic ninja. You're not just memorizing, you're mastering. So next time somebody drops a word like cholecystectomy, you'll just nod and say, "Oh, they removed the gallbladder. Now go forth and decode the words." Do it boldly. Just remember, if it ends in anything that you don't know, it might mean pertaining to. Thank you so much for your time. If you like this, you thought it was valuable information or even semi-valuable information, let me know because I'm here for you. I'm here to help you learn. I am here for healthcare professionals. I'm here for people who are learning to be healthcare professionals, and I am here for people who are patients and just want to better understand their care. Let me know what you are struggling with, and I will provide it. I will also get better at making video along the way. Thanks so much for listening. Please like, share, follow, subscribe, do all the things. I can't wait to talk to you.